Welcome back to MLT World channel, friend. Today the topic I am going to discuss with all of you is about serum ferritin test. Let's start the lecture. What is ferritin? Ferritin is protein by nature, and ferritin is made by the liver, and the main function of ferritin is to store the iron. Why iron need iron? As we all know, is very important for the production of red blood cells that will deliver oxygen to each part of the body, to the cells and the tissues. And iron is very important for healthy muscles, bone marrow and organ functions. So body store extra iron in the ferritin for later use, and which is usually concentrated in liver and the cells of immune system. So when body used iron, the cells will release a small amount of ferritin also in the blood that we will check in the laboratory. And because of this ferritin level, it will reflect the amount of iron in our body is enough or not. So what are the purposes we need to check the serum ferritin level? First of all, the most common is iron deficiency anemia. To diagnose iron deficiency anemia, it's better to check first the ferritin level, that there is enough iron stored in ferritin or not. We can get idea. Next is hemochromatosis, that is like overload of iron. If there is too much iron in the body, then also need to check this test. This is also called as iron overload. Next purpose is to check ferritin is for liver diseases, because as I told that ferritin is made by the liver. So if there will be more ferritin will be released, that can indicate also the liver disease. Restless leg syndrome, that a patient will feel tingling or burning feeling they will feel in the legs. That is a rare disorder, but that also caused by the lack of iron. Next is adult still disease onset, that also called as adult onset still disease, AOSD, and that is uncommon disease, and that can cause joint pain, fever and rash, and often with high ferritin levels. So that's why also we need to check the ferritin level. Also need to monitor for chronic diseases like kidney disease, long-term diseases that may affect iron levels. So in that case also need to check the ferritin level. Next is people who have underweight, for them also need to check. And females who are experiencing having bleeding, menstrual bleeding, for them also need to check ferritin. And those females who are pregnant, for them also need to check ferritin level. Next is people who have issues with the food absorption, like irritable bowel syndrome, we will call inflammatory bowel disease also, and who had certain gastrointestinal surgical procedures. Now we will see the symptoms. If there is low ferritin level, then what will be the symptoms? Then it will be fatigue, we will call it as tiredness, pale skin, weakness, dizziness, shortness of breath, dyspnea, and rapid heartbeat, tachycardia. If high ferritin level, then what will be the symptoms? There will be painful joints, heart issues, unexplained weight loss, abdominal pain, and loss of body hair, and there is fatigue or loss of energy also will be. Now for to check the ferritin level, what type of sample we need? From the vein we will collect blood sample. The ferritin level is checked by the blood, and the blood will collect in the clot activator tube, either red cap or yellow cap. And for this test no need any fasting, anytime patient can give the blood. And after when the blood will reach into the lab will centrifuge that blood, and from the serum of the blood this test is performed. That's why we will call this test ferritin test also, and serum ferritin test, because by serum this test is performed. Now at the end we will see the normal ranges, that what are the normal ranges. Ferritin is normally reported as nanogram per ml also, and microgram per liter, so it will be same only. In men it will be 18 to 270 nanogram per ml. In female it will be 18 to 160 nanogram per ml. And children from 6 months to 15 years or until puberty, it will be 7 to 140 nanogram per ml. In babies from 1 to 5 months, it will be 50 to 200 nanogram per ml, and in newborn it will be 25 to 200 nanogram per ml. So this video is completed here. I hope that you understand the basic concept about ferritin test, that what is the purpose, symptoms, and how we will collect the blood sample, and what are the normal ranges, and what is ferritin also. So if you have any question, you can write in comment. If you like this video, press the like button, do comment and share, and don't forget to subscribe the channel. And if you want to know about any other test information, just write in comment box. I will try to share the information related to that test also. Thank you.